And, if we emphasize prevention more, that prevention is much lower cost than expensive treatments on the other end of the healthcare continuum. So, for example, just having some very cheap early interventions on people who are showing signs of being at risk for diabetes. There are a lot of things we're not doing, that Medi-Cal is not doing, that the healthcare delivery system in general is not doing to prevent people from advancing to full-on diabetes. Once they do, the cost of dialysis, for example, is hugely expensive. And then we feel, of course, we don't have any choice but to pay for that. But we actually are making the choice to not invest in the preventive things. Those things, some of them are within the healthcare delivery system itself, just screenings and making sure we provide that kind of prevention. But again, a lot of those factors that will determine whether we get a handle on this epidemic of diabetes are things we don't think of as traditional health or not directly in the healthcare delivery system, like soda. Sodas are something that the more we learn, the more we realize that it's sort of like tobacco in terms of a product in our society that's costing us a fortune in terms of health, life, diabetes, amputations. But we're not really doing anything to try to get the word out about that, to try to curtail some of the advertising of sodas.
A few of our listeners may have just dropped their big gulp.
Well, I hope they'll get their kids to drop it at least.
Well, what you're really talking
the health hazard for children is just alarming the more we learn about the science.
Well, you're really talking about this age-old adage of an ounce of prevention is worth a pound of cure.
Exactly. Yeah.